Thank you very much, Program Director. I take this opportunity to express our greetings to all of you, Excellencies, Honorable Ministers present in this very important summit. I bring warm greetings from the Kingdom of Eswatini, especially from the Minister for Health, Senator Lizinkosi, who could not make it to this summit. I want to congratulate the Honorable Minister of Health in the Republic of India for setting up such a very important summit, as well as express our gratitude on behalf of the kingdom or the people of the Kingdom of Eswatini for the role that India plays in the global pharmaceutical economies. We have seen this as we were responding to this pandemic. The Kingdom of Eswatini received a quite sizable amount of pharmaceutical products from India. With regards to this topic, resilient health systems, we want to say that we have adopted the guidance that WHO has given to countries in as far as health systems building blocks. So we are following those six building blocks: service delivery, health workforce, health financing, medicines, vaccines and technologies, health informatics, as well as governance. And the aim of this, as we know, is that we need to ensure that health systems are able to engage in planning, mitigating negative consequences, as well as recovering quickly from any shock, such as the pandemics or be it economic crisis and other negative effects, including climate change. And the aim is to ensure that we also have ability to learn specific lessons and adapt to the negative effects of that. And that is one of the most important aspects of building resilient health systems. Just briefly, in terms of our experience on the pandemic, for the past 3 years, we have been responding to the COVID-19 pandemic. And since March 2020, when we discovered the first case, we have had about 5 significant waves of COVID-19, the second being the worst one, where we saw a high rate, fatality rate, as well as morbidity. But in general, the case fatality rate to COVID has remained below to basically 1.9%. Unfortunately, in the midst of the response to the pandemic in 2021, the country experienced one of the very unfortunate happenings where political and civic unrest happened. So, combining the COVID-19 as well and the civil unrest, these two challenged very much the health system. But we are happy to say that our response was quite satisfactory, as well as learning very important lessons from those two occurrences. So, part of our lessons, one is that epidemic preparedness is key. In terms of planning, we believe that at central level, at a district level, as well as local facility level, there has to be the issue of epidemic preparedness in our plans. And that is very, very key. Health facilities were found wanting when it comes to epidemic preparedness when the COVID-19 came through our borders. We also believe that ministries of health should ring fence a specific budget that could be utilized to respond to any occurrence, epidemic issues. We also believe that countries must have integrated systems for disease surveillance, which are strengthened so that we are able to identify public health threats quickly and respond accordingly. Um, a number of excellencies have mentioned that there is need to invest significantly in healthcare workers, in training and others. So, in this regard, we believe that pre-service training should include in their syllabus. They should include public health emergency management systems, as well as ensuring that there is regular evaluation of health systems in as far as epidemic preparedness and response is concerned. And this should be an ongoing and not a once off. So, WHO and other institutions like the CDCs should actually collaborate in that regard. We learned that innovation is key as well. We are used to doing things in a particular way, and COVID 19 you showed us that some of these ways may not necessarily be effective. So, quickly coming up with new ways of response was very key as we were responding to COVID 19. We also learned that we need to have distinct technical package of limited but very high prioritized and evidence-based interventions which will produce a major impact as we respond. Effective performance management is also very, very important. Partnerships, I think, again, a number of the excellencies have mentioned this. Partnerships are very key. We saw this coalition with public and private sector organizations, partnerships with our communities, because without communities participating actively, whatever response to any epidemic would be a failure. Timely communication and sharing of information to the public also showed us that it was very important. This was also important to ensure that there is effective decision making, as well as the public coming together to work with you. In order for them to do that, they have to be informed. So, particularly these days where we know that there is a lot of information sharing in the social media, but information can be misleading sometimes. So proper information sharing is very key. I want to also share that we learned that political commitment in building resilient health system is very, very important. And to that, we want to express our sincere gratitude to His Majesty the King, King Mswati III, for coming out and showing us what political commitment is in as far as managing and responding to COVID-19. He led with example in that regard. Currently, the Kingdom of Eswatini is investing time and resources in strengthening our public health emergency management system. Daily, we get surveillance of all public health threats, and weekly, we do analysis and we do immediate case investigation and continue to do contact tracing. We do simulation exercises as well as ensuring that we have healthy stockpiling. We also are strengthening the public health emergency operations center for proper coordination so that things do not fall over the place, but there is proper coordination. We continue to invest in capacity building for healthcare workers at all levels because, again, this is very key. They drive the response on the ground and therefore they need proper capacity in that regard. We are currently in discussion with the Africa CDC in terms of establishing a Eswatini Public Health Institute as a way of elevating the epidemic preparedness and response agenda. And we also are looking at strengthening service delivery models. One of the things that hit us most during, particularly the second wave of COVID that was driven by Delta variant was lack of oxygen. And so we are building, resilience around that area, ensuring that we have our own oxygen stockpiling, as well as ability to generate our own oxygen. Currently, we do have three generating capacity stations within the country, and this we believe that is a way to go. In terms of the South-South collaboration, I think I would like to share maybe a few things that we believe as Eswatini we should work together with other countries. One is in terms of building medicines and vaccines manufacturing capacity, particularly in Africa. India played a very, very important role in this regard, and we believe we can learn a lot. We believe that we can collaborate with India as Africa in terms of setting up manufacturing plants, particularly to ensure that there is, no disturbance or disruptions in as far as medicines and vaccines are concerned. We also are looking at establishing pooled procurement mechanisms amongst countries. Eswatini is a small country. Economies of scales are always against us. So coming together with other countries and collaborate and ensure that this pool procurement mechanism would benefit us a lot. We also believe that we need to share technical expertise in health information and technologies, such as telemedicine and other things like telepathology and others. Again, there are attempts to collaborate with countries like India in that regard. And lastly, we need to invest in capacity building for healthcare workers. This could be short and long term in the area of epidemiology and epidemic preparedness. With that, Excellencies, I want to thank you and wish India well as you start the journey of the G20 presidency. Thank you very much. Thank you, Excellency. It is my honor to invite the acting minister